It's no joke that the number one reason for suicide in seniors is chronic pain. And when they get we have patients, they go from a 9 out of 10 pain to a 5. That's still a ton of pain, but they're ecstatic because they don't look at a bridge and go, I should probably jump off that.
Yeah.
I'd rather be dead than live like this anymore, right? And that's just an awful way to have to go through life. So if we can move the needle on that, it's huge.
Welcome to episode 10 of the Dr. Chris Stepien Show, where my mission is to help people who are suffering in pain, and the doctors and therapists and healers who are committed to doing something about it. Today is a very special day for me because I have not only one of my favorite people on earth sitting in front of me, but also, I'm glad you're laughing, but also somebody who, from my perspective, has inspired, at this point, dozens of pain doctors and therapists who are motivated at fixing this very large problem, which is chronic musculoskeletal pain for people that can't find solutions to it. Dr. Matt Lytle is the owner and founder of Precision Health Group in St. Louis, Missouri, and he currently coaches about 20-ish pain doctors and therapists across the United States and Canada. And he is also the reason why Adhesion Release Methods, which is my translation of his principles and concepts, exists. And I am working to get his material out there through the filtration of my lens so that other pain doctors and therapists who are new to this type of diagnosis and treatment for this very common problem, adhesion, exists. Before we get into a conversation, I think it's important that we briefly speak about the past and the people who have set us up to be successful. And Dr. Leahy was the founder of Active Release Technique, and this was the human beings learned that you could treat individual muscle tissues. And then Dr. Brady, who was the creator of Integrative Diagnosis, taught Integrative Diagnosis from about 2006 to 2020. And he was the mentor of both Dr. Matt and myself. Yep. And he retired in 2020. Dr. Brady was an ex-ART instructor, and he thought to himself, this is really good. It gave me this ability to treat individual muscles, but I think that I can do better. And that's why he started Integrative Diagnosis. Before I get into a little bit of our past with your beginnings with Dr. Brady and Integrative Diagnosis, the first thing I wanted to ask you was, I am curious, when was the first moment in your history that you thought to yourself you want to be some type of doctor, healer, chiropractor, whatever?
When I was 7.
Tell me more.
I fractured my kneecap in a tumbling run when I was in gymnastics, and I went to an ortho, and he took care of everything. I was like, this is the most interesting thing ever. I'm going to do this. And then I stayed on that course all the way through college, and then when I was in town interviewing at St. Louis University Med School, I smoked my disc doing a squat, warm-up squat. It was really weird. And my wife took me to her local chiro, and I walked in, bent over, and left standing up straight. I was like, this is weird. And so he asked me if I ever considered chiropractic college, and I said no, not till now. And so the rest is history. And so then I went to chiropractic school, and so it was great.
Why, when you were 7 years old, were you interested by what the orthopedic doctor did?
I don't know. It was fascinating how he found the problem, solved it, gave me the whole, and it wasn't even hard. It was a kneecap fracture. You just put a brace on it, wait 6 weeks, your body will take care of it. But I just thought that was interesting that he was a guy that you went to when you had a problem, and he fixed it for you, which is great.
The problem-solving piece.
Yeah, probably.
I like it. But there must be some type of health or healing thing. You can solve problems as an engineer. Why people?
I don't know. I've always liked exercise. I've always liked training. I've always liked those things, but I don't know if that was influenced way back then. But it's just weird to talk about myself. For me, I think, I don't know. I really, it's just, you have to, I've always wanted to just help others. Sounds so cheesy and corny and like very cliched, but it really, I think it goes further. Your job is to serve people and make the world better. So, and maybe that was something my parents instilled. I don't know. But you just need to serve. And so this is where I found an ability to serve. And so it was great. And so that was something about that interaction was interesting to me. And then that just kind of translated into more stuff as I got further into it. Because like even when I was at chiropractic college, we were doing manipulations, adjustments, which is what the doc did to me, because I actually went to the school that he taught at. And it was great, and that stuff was good. But there's a few things I felt like I had the spine down okay, but then I couldn't help shoulders, couldn't help knees. And so I was like, well, how do I fix this? And then one of the docs, a guy named Bob Kuhn, he was the clinical director there. He said, well, you need to look at ART. And that's how I got into that. And then I met Bill, and Bill was really smart. And I was like, oh, I'm going to hang out with you because you're really smart. And then he started telling me that he was going to teach his own seminars because he thought the diagnosis part was being left out of ART. So I was like, great. Because in original seminars, he would teach diagnosis and have you just go take ART seminars to treat. And so when he started those in 2006, I said, you let me know, I'll be there. And then I was there and I went to every single one. I only missed one, honestly, when he first started of his core seminars because of my son's second birthday. And still to this day, I'm like, I don't know why I wasn't there. Because all joking aside, my wife was like, you're going to stay here. And I was like, he's not going to remember. It's going to be fine. But I'm glad I was at the birthday. But that's the only one I ever missed.
Okay. You that was great. You answered some of my questions ahead of time. A lot of this interview is for me because there's some questions that I've never asked you, and you're somebody who inspires me and I look up to. So I hear the problem solving and you want to help people thing. And from my perspective too, having been personally mentored by you since 2020, you're somebody who cares very deeply about people. So that makes sense to me why you wanted to be some type of doctor, and then the chiropractor fixed you with your back. And you're like, oh, I can do this fast and without medication, which is probably interesting. Then you were in chiropractic school and they teach you how to do spinal stuff.
Yeah, and honestly, it was so well received in chiropractic college.
What was received?
Like how well I was received. So they just like, yeah, I was an exercise science major. I liked exercise in the physical aspect. So I liked the physicalness of the chiro components. Right. More nutrition, more understanding of the body, more understanding of anatomy, deeper understanding of all that stuff. I was like, oh, this is right up my alley. And I was thinking orthopedics for med school. And those schools, you're not as well received. I mean, they're just not like, oh, you're amazing. They're not nice to you. I mean, they're like, are you good enough to come here? That's what we're going to check. And I get it. It's super competitive. Right. And it makes sense. And chiro was just a better experience. And then honestly, I said, my grandmother, wonderful, wonderful Catholic lady, she sent me a novena, which is a focused prayer you do for 9 days. Mm. And we did that to decide, should I continue the med school route or go chiropractic college? And God said, go chiropractic college.
Love it.
Because I got punched in the nuts from a couple of the med school stuff. I was like, nope, you clearly don't want that door open.
Love it.
Yeah, so that's what happened.
I didn't know about that. And I was going to ask you about, we'll get into God and all that stuff soon. So that's very interesting, though, that you were led this way. And then when you were in school, you started doing extremity stuff, or you were curious about the extremity stuff, and that one doctor said do ART to treat extremities. Yeah,
if I couldn't solve a problem, I was like, well, I can't fix this. Right. And so I was literally just looking for solutions to the problems that showed up. And so if I couldn't fix it, I was like, this isn't okay. And I was never, really very commonly in healthcare, we see all the time. I mean, we're both in the chronic pain world. People get blamed as patients for stuff all the time because the doctor sucks. Right. And it's not that they're bad. It's that they have this narrow window, right, but they act as though their knowledge is complete. Right. And they have all good intentions to help you. Right. They're just out of the breadth of what they can do. That's why not everybody's a neurosurgeon, not everybody's an OB, not everybody's a cardiologist, right? If they're not aware of this world, then, or they don't think it's even possible, which is what you run into now. You run into people go, you can't do that. Even though we have patients we solve all the time, that's essentially the issue. And so I always took it from a standpoint of my failing more than the patient failing. And there's probably somewhere that comes from, because I still struggle with that when I go.
You take a lot of responsibility.
Yeah. And even with patients, it used to be a problem where I would get mad and really upset because I couldn't solve one of the patient's problems and I wouldn't look at it completely objectively. And so actually working with Dr. Cohen, Brandon's been very helpful for that, just kind of a perspective. Like, here's what, because he's very detailed. So he'll go through a case and like, no, we did all the things. Here's where we're at, and this is the right conclusion. So where do we go to from here? And so it's been very, very helpful. It's been good and just better all the way around.
I love it. Yeah. ART gave you an extra tool to fix more problems.
Yeah, correct.
What happened at ART when Dr. Brady, this brilliant man who started integrative diagnosis, what about him intrigued you?
He paid attention to things everybody else was skipping over. Always. So and when it came down to a simple thing, like I remember it to this day, we were treating soleus or tibialis posterior. It was tibialis posterior. And he goes, here's what everybody's going to do. And he goes, here's what I need you to do first. He was all about sync, right? The angle of depth and tension, right? And he was he prefaced everything. He was very specific. Other guys, just grab on, you sink in, push. And they didn't pay attention to details. I was like, you're paying attention to everybody else. And when you did it, it felt way different than everybody else, even the other instructors. I need to hang out with you. I literally would not move with my group. I would just stay in his group until people go, you're not, like maybe he's group 4, right? When I was a 6, I would just stay in 4 until someone would be like, hey, you don't have a 4. You need to get out of here. Okay? And I would find a way to circle back.
Amazing. That's brilliant.
I used to buy him lunch. When I was a student, I didn't have any money. I'd buy him lunch, not eat myself because I wanted to talk to him more.
Brilliant.
Yeah.
You saw him doing something different and it seemed right to you, whether it was intuitive.
Well, it was better results.
It felt better when you got treatment.
Yeah, it felt better, like he was doing the right thing.
I love it. So this is interesting because you probably get this on your Instagram. Has 45,000 people now, Precision Health Group. And we have a decent following at Barefoot Rehab. Less than you, but we're competitors. So I'm trying to beat you and you're trying to beat me, which is great because we help more people. Amen. And people will often say, you're just doing active release technique. Mm-hmm. You're just doing ART. Mm-hmm. And so right there is where the split happened, though, is Dr. Brady was an ART instructor, and he's like, everybody's being taught to do it this way, and that's where I need to start integrative diagnosis so that this is going to be different.
I would even go as far as say is it was more the diagnostic approach, because they go, where's it hurt? Well, it could be any of these things. And he was like, no, we can do better than that. We can narrow this list. And he's like, that's what we need to do. So he worked on that to start. Right. And then he was like, you know what? We could do better with treatment too. And then he started challenging that, doing that stuff. So it started out just truly diagnostic only. And I mean, I went to his first seminar. I had a list of 15 people I had failed because I'm very personally responsible, right? In 30 minutes of listening to his lectures. I was like, oh crap. And that's when there's a hole in the game, I hate it. Right. It's not appropriate. And so doctors that don't want to do that or don't think they're complete, like you should be done. Right. If you're gonna know enough, then you're done. Go retire. Right. It's okay. You just shouldn't be doing it anymore.
Brilliant. Yeah, just yesterday morning, I think I told you about that little daily huddle that we do every morning. And if a patient comes, they're not at the door, we invite them in. And so we're reading that thing, and everybody shares what they're resonating with. And at the end of the huddle, we broke. It's like a little sports huddle.
Yeah, that's awesome.
Up. And then Bill, he's looking at the core values, and he's saying, what's up with that competitive greatness core value? And I was like, oh, let me tell you about it. We stole it from Alex Hormozy, but the idea with it is that as doctors and therapists, we want to be as great as we possibly can because we feel like if we're great, that's how we actually serve people who are suffering in pain. And then he said, I don't think I ever want to go to another doctor who doesn't have that type of value as
Amen.
Running their practice.
And so we use that as humility. Like when we talk about the different things, like we have those characteristics we think make a good doctor, and it's, you have precision, humility, excellence, collaboration. I'm forgetting the other ones, which is terrible. But one of those things, and the humility one resonates with me a ton, because if you're not humble, and if you think about anybody who's been amazing in anything, they have a humble excellence. Like they're like, yeah, I can hang, but I have no problem getting my teeth kicked in, and I'm just gonna go, okay, that's what I got to know, and that's great. Recently, I met with a guy, you know him, Ryan Pribble, right? So he has gone down a really neat rabbit hole of all the exercise side of things, right? And trying to parse that out with the stuff that we know and how it works, because there's lots of stuff out there and all these theories, and he's trying to break all that down and figure out what's most effective. And he did a deep dive, and there's a major hole in our game with that. So now Dr. Cohen and I are doing that stuff, so it's super fun. Yeah, but that's the whole point. Like that's what makes it exciting.
I love it. So in integrative diagnosis is basically made you a better thinking process, better ability to diagnose, better ability to treat. And then Dr. Brady retires in 2020. Yep. And then at some point you're the lead instructor because you were his first instructor. Sure. And then what inspired you to want to take on a bunch of the doctors and therapists that didn't have anywhere else to go.
Yeah, I would honestly say it was just a need. They're like, hey, can we hang out? Can we do whatever else? I said, okay. So then I started coaching some of them because they just had questions on it. I was like, well, let's just do consult calls like you used to with him. And I did a handful of those with like only 1 or 2 docs. And then they started talking to each other. I was like, you want to work with other guys and have collaborations so you can work with this stuff. And then that turned into, hey, can we just have some time with you? And then we started doing a couple guys on calls, and it just kind of expanded. And then they're like, I'd like to get some hands-on stuff, get some treatment. And so we started doing hands-on stuff. So it just kind of grew organically out of a need, because I was so I started Bill in 2006, took his first one. And so since I was the first instructor, they're kind of like, well, you can at least help us. And Bill was kind of changing his focus and kind of his methodology and how he was doing stuff. And I didn't know that I loved where it was going. So I really doubled down on trying to get better and get to the skill set manually and physically, that skill, to as close to him as I possibly could, so I could then transfer this to somebody else and do that just in case we were to part ways. And so that's essentially what it is. And then when Brandon came on to the office, that just skyrocketed because we were just both just curious, and curiosity, one of the things. There you go. It just started to expand from there, which is really awesome. That was a huge step in our palpation skills.
Dr. Brandon joining Precision
for
Health
sure.
Group.
It was a big deal.
Right.
Because he had 9 months or 10 months with Dr. Brady.
Right.
And so and that's all he focused on was palpation.
Right.
So when he came here, it was nuts. We just kept going hard.
Right. So yeah, you saw the need for other doctors and therapists to keep developing themselves so that their patient populations.
Yeah, you'll get bored, you'll get burnt out, because if you start getting frustrated and can't solve problems and no one's there to help you figure it out, you're going to think that you're right and everybody else is doing the wrong thing.
Right.
And then there's nowhere to go. And that's essentially what happened to me when I was in practice. I was like, practice is kind of boring. Nothing really challenged me anymore, because I didn't realize how much I didn't know. And then when I blew out my own neck and had to go see Dr. Brady, and it really did truly change my life, I was like, oh, this is how good you can be. I have a lot of work to do. Again, just aware of a hole in the game.
Right.
So now I always assume there's a hole, more so than I ever did before.
Right. How many times did you fly up to see Dr. Brady from Missouri to Boston to get treatment for your neck? And how long?
So that's funny.
And how much money do you think you spent on your skill set?
I know. So 2 things. When people tell me that I'm far away, I always chuckle because I had to go to Boston. And the trips by themselves, just to get there and hotel stay, were like $800. Then I had the treatment on top of it. So it was like $1,000 or $1,500 large trip. And I did once a week for 12 weeks. Right. And when it was at seminars, I get them at seminars. So thank goodness there was a couple of those I didn't make the flight. And he was
$12,000 in 3 months.
Yeah.
Basically.
Yeah.
For the start of it.
Yeah. And he was gracious enough, because I was his instructor, that he didn't charge me for the treatments and stuff as things. That's how he developed small group. Mm-hmm. It's because I was like, when he told me, I was like, man, I pay you to hang out with you and do one-on-one stuff like this, or be in a group. He's like, oh, really? And then he created a small group right after that, like a month later. Mm-hmm. And so it was all that stuff. And then from seminars and stuff, it was just constant. There's things, as an instructor, that was the only benefit that we had, because it wasn't like it was you gained a bunch of knowledge and you had access to him, and that was the benefit, right? So it wasn't like, and that was okay. Like I wasn't like, oh, I need to get paid a ton. It was always the fact that we just didn't get charged for a lot of the things everybody else did.
Right. It allowed you to get better by hanging out.
Yeah, it was a huge thing, right?
I love it. So then you started teaching and training these other instructors across the United States. Yeah. And I think, just speaking to your perspective as far as methodology, which is my perspective at Adhesion Release Methods perspective, it's the idea that choosing a tool really matters. And if we're diagnosing and treating adhesion as adhesion specialists, we can't be reductionist when it comes to which tool we use. For example, some providers are going to use just instruments like Graston or whatever tool they're going to use. Job, right? Or there are a lot of providers, especially now in 2024 who are all 100% shockwave.
Yeah,
And then there are some who are just hands too.
Yeah, it's cliched. And it would say that you could say like a carpenter only uses a hammer. It's just dumb. Be like, why would he ever do that? Right. Same thing for us. And so that's assuming that, and what they make the assumptions is that that tool they have can get rid of any adhesion they need to treat.
Right.
And if it doesn't work, it's because you can't do it another way. So there's the two arguments. What we saw when Brandon came to the office, he had been all shockwave for 10 months. And he treated my shoulder manually because we didn't have a shockwave at that point. Or to use, I think we were at my house. And it was the best treatment he's ever done. And he hadn't done a manual treatment on his shoulder in a year almost. And I was like, how is that possible? And really it told us that the palpation skills are that's the perishable skill. If you palpate, you can treat whatever you need to. And so that's really the nuanced difference with that. It's like, you're a musician, you play guitar, right? You pick your best guitarist, right? If he does a little movement of his finger, it sounds way different than if I do that same little movement on the guitar with my finger. But you can hear an audible difference, right? With our palpation, a quarter inch turn to your hand may make all the difference in the world on breaking that adhesion down, but only you can feel it and the patient can feel it. Nobody else can see a difference. So they're like, yeah, right, whatever, you're making that up, dude. Right. And that's the difference,
right?
In my opinion. So.
Yeah, what I've been telling the Adhesion Release Methods providers is that between me and Dr. Lytle, the biggest tax that I have to pay is a palpation tax to get to where you are. And so if I understand that what's limiting me from being where your skill level is my ability to feel, then I understand that every day, every month, every year that goes by that I'm not feeling better, I am paying a tax, and the people who suffer are ultimately our patients.
Right. It's a rough. It's inspiring, but also kind of it's hard to go. The reason why they're not better is because I just couldn't get it done. Like that's a hard place to sit. You got to be okay with being uncomfortable like that. But it's also it's not like you don't care or trying. It's just don't throw up your hands, and also don't be like I've got it all figured out. Like there's a happy place in there that you can be like, yeah, I'm just going to keep working on getting better.
Right.
And what's the other option? Not pursue adhesion work, right?
Right.
And that's always this scary part of the travesty is when someone doesn't get the treatment or isn't patient enough with the treatment,
right?
And they bail early and they're like, oh, it didn't work. Like, no, it just wasn't everything wasn't lined up all the way.
Right. Yeah, that's brilliant. Let's talk about the diagnosis and treatment of adhesion really quickly. Who are we helping? Who are we helping as a patient? Who do we select? Who's a good selection for us, for somebody who we can really help?
My favorite patients are the ones who've had all the diagnostic tests and everything came back clean and they still have all their problems.
In pain.
Yeah.
Physical pain, musculoskeletal pain.
Yeah, musculoskeletal pain is our sweet spot, right? Obviously. The hard part you get into, and there's, obviously we've talked about this before, Dr. Brady taught us this, right? There's a couple buckets, right? You have structure, you have function, you got metabolic, and you got psychological/stress, right? So for us, it's musculoskeletal pain that has a mechanical origin and an organic mechanical issue. And even if they have structural issues, that's still okay. But people that have had mechanical pain that have done all the tests and their structure looks pristine or looks good and they say it's all normal and okay and they still have their problem, those are really good for us because that means this is the one thing they haven't considered, because adhesion is the one thing that nobody ever considers.
And for the person suffering in pain right now and they're watching this, mechanical pain means pain with movement or activity.
Yeah, you go through a motion or a position, you're like, that'll make me worse.
Not fibromyalgia or...
So those things are always good, but you have to have, when you have chronic pain all the time, just sitting there breathing, nothing really makes it better. Everything kind of makes it worse. And there's other things that make it way worse, but just kind of existing makes it worse. There has to be an inflammatory element, right? Which you know and agree with. The point of that is that it's hard to do the inflammatory side because it's a ton of work on the patient. Like it's hard. It's hard to cut out all the things when you go out to eat and you can't have three-quarters of things on the menu. Everybody else gets to enjoy, and you have to go, I can have water and some lettuce. Right. Don't put anything on it. Right? It doesn't let you live socially how we live in the culture, and so it's rough and it's uncomfortable, and you don't look sick.
Right.
You look like you're a complainer.
Right.
So why do they not feel bad for you? Because you don't look like you have, you're not bald with like a cancer patient. You don't have a bunch of things going there. You don't have things growing on you. You're just uncomfortable all the time. Right. But we literally have patients that will stand in the office sweating because they're in that much pain.
Right.
Just trying to stand and talk to us as we go through the consultation. And you're just like, okay. And it's always funny. I think we're the best patients ever. You probably think you're the best patients ever. It's fine. We're competitors. It's great. But the point is that it's they're just grateful, happy people that have been through a lot. And when they get we have patients, they go from a 9 out of 10 pain to a 5. That's still a ton of pain.
Right.
But they're ecstatic.
They're happy.
Because they don't look at a bridge and go, I should probably jump off that.
Yeah.
Right? It's no joke that the number one reason for suicide in seniors is chronic pain.
Right.
That's real.
Right.
So, and it's not because they're crazy. Like they literally will find a way to commit suicide without committing suicide.
Right.
Because that way they don't lose their life insurance, all the other things they have for their family, right? They have suicide clauses. You don't go through that much thought because you just, or else you're just like, I'd rather be dead than live like this anymore. Right? And that's just an awful way to have to go through life. So if we can move the needle on that, that's huge.
Yeah. Well, you're speaking to why I wanted to talk to you in front of a camera and microphones, and I know that you didn't want to talk or have this conversation, but it's what's interesting to me for having this clinic and then trying to teach the new doctors and providers is that it's interesting to me that once patients start getting better and they get an exam and then they're touched in all these different spots and they're like, whoa, you're like finding all my spots. And then we start getting them relief. And then they see some videos of we're doing or that we'll tag you somehow on social media. And they say, Chris, I want to hear about what you're trying to do with getting more providers doing this.
Sure.
And I was like, oh, when they're in pain and they find an answer, they care about what we're doing, but they really want to have other people. They want other people to experience the relief that they're getting. Yeah. So I think people care who you are because you're helping other doctors and therapists get this out there. And I couldn't do it. I'm not as intelligent, and you're like a dog focused on a bone. I think you're gonna like chew that bone to death and figure it out. I'll chew the bone a little bit, but I won't be able to figure out like you do. So I think people care that you're really trying to get other providers, including me, doing this. And it just speaks to me from a level of this matters to a lot of people suffering chronic pain that can't find answers.
It's funny, when Dr. Brady first started this work, I was like, why did you do all this? Like, you didn't have to. He's like, if I knew that somebody else knew all this stuff and didn't share it, I'd be pissed. Fair. And so I always chuckled at that answer. But the reality is, I think for people, is that as much as everyone wants to say the world isn't really awesome anymore, people inherently want to help others, I think, is a real thing. And so they don't want people to suffer if they don't have to. And so the question is, and this is always a hard part for patients. A lot of people, and I always say this, if people don't want to do the work, they don't want to go through the nutritional change, or they don't want to come in to see us or a patient or see you, the statement I make to my staff is they haven't suffered enough. And they just look at me a little puzzled. I'm like, look, when you want to basically have your body respond without you altering anything about your life. Mm-hmm. And that life is what created your body to begin that way. It wasn't somebody else's fault. Not saying that you're a bad person because you have this thing fall apart. Right. And there are circumstances where, events happen that you're out of your control. But at the end of the day, you got to play the cards you're dealt. And so it's how much work do you want to put into this stuff? Right. And some people just get overwhelmed. Some people go, well, I shouldn't have to. And that's in anything, right? So that's part of the struggle, is that there has to be enough where they're like, I'm ready to take that step forward. And very oftentimes they had so many losses, they're not willing to take one more. Right. And so they screen a ton. They're a little scrupulous. They're like, I don't know. And so that's fine too. So one of our responsibilities, I think, as a doc is, one is to obviously do a good job and help the patients we can. But then two is to help people get out of their own way, which is the reason why we even have social media. Is why you're doing all the stuff you're doing, everything else, because part of it is, if people can hear one other thing that they might get them out of their own way and want to take that next step, that's awesome. Right. Yeah, it's really great.
Right. I love it. So for your practice, Precision Health Group, that's you and Dr. Brandon Cohen are there. And how many patients per week or month do you have flying in from outside of Missouri to see you?
Our out-of-towners, as we call them, it's probably, I would say probably 10% of our practice load.
Amazing.
Yeah.
Amazing.
Yeah, it'd be, and it's awesome. I mean, it really is good. And it's almost, again, I like the challenges and the problem solving, as I'm sure you do too. It's fun to see what you can get done in a short period of time. I almost make it a game. It sounds terrible. Not that I'm gaming with their health, but it's like, I'm like, oh, we're going to see you for 3 days. Let's see what we can get done.
Right.
Let's see what we can accomplish. And if we can get, I mean, if we've had some people that have come back with like 60%, 70% improvement in 3 treatments. I mean, that shocks the crap out of me. I'm like, no way. How long have you had this thing? Right. And it's nuts. And then, or they're like, oh yeah, it's gone. Thanks. You're like, what? Okay. And we have other people. Kudos to them that have come up for an entire year, and they're coming up from 6 hours away drive, or they're flying in for a year. I mean, it's a lot. So, I mean, it's great. But I mean, you only have one body, and it's got to last you forever. So.
Yeah. I mean, chronic pain haunts people. I think 50 million people in the United States each day have some level of chronic pain. So it makes sense that that many people are traveling. And I know that we're in New Jersey, you're in Missouri, so you're more in the center of the United States. So we try to make sure that people are flying to you, especially since there are 2 of you instead of coming to New Jersey. But that all makes sense. I always love and appreciate hearing some of the stories that you share of both the successes and wins and the failures of other providers. For example, you were telling me probably 6 months ago, but some guy had carpal tunnel syndrome surgery, and surprise, his symptoms didn't get better because he had a radial nerve problem. And he got misdiagnosed and therefore ended up in your office. What's the patient story in the last week or month that fascinates you the most?
We had a kid that came in, he was 17, runner, track athlete, had knee pain. On the inside of his knee, and it was 9 out of 10 pain, up to 9 out of 10. And sometimes he'd be down to 2 or 3, and then he'd take when it get really bad, he would rest, and then he would try to run again, and it would do okay. And then after he'd run for a little while, he'd get to a certain amount of mileage, it'd start to hurt again, and he'd go fluctuate. He did that for 18 months. 18 months. And I was like, okay, does anybody take any pictures? No. What? I mean, that's not a high bar. This is like, you have knee pain, and this is 9 out of 10 pain. Right? And 9 out of 10 pain in a kid, right? 9 out of 10 is like, the only thing worse is if I drove over you with my truck, which is always, it's always funny to me. People go, I have 10 out of 10 pain. And they're talking like we're talking.
Right.
I'm like, no, that's not 10.
Right.
Like if I put you outside, drove you in my car, you wouldn't be talking to me like this. You'd be really uncomfortable.
Right.
So you're probably actually more like a 4.
Right.
But it feels like the worst thing you ever had.
Right.
So that's why it's 9 out of 10, which I get.
Right.
But I still sometimes I have a burning desire to correct you, like that's not accurate, but it's fine. So this kid, I mean, I was like, well, when you have 9 out of 10 pain, what do you do? He goes, I can't walk. Like literally have to stay off of it. And that didn't warrant pictures. He had a stress reaction. And so maybe they took x-rays, but nothing else after that. And so he had his entire femoral condyle was white on the MRI. Great. So you're going to rest for 12 weeks. And we did and pressure wave is great because it actually helps with non-union fracture. We shot up a pressure wave and cleaned up some adhesion stuff because his motion was good. He just had knee pain. I was like, this doesn't make any sense, especially that much intense. And he didn't seem emotionally charged by it. He was just like, this just sucks. Can we fix it? We got the MRI, and so then we did PT and a zero gravity treadmill, and he's done awesome. He's running track in college. And I was like, this is crazy. Another case of misdiagnosis. Yeah, but the details matter, and I guess that's really been, so working with Dr. Brandon has been really helpful because he's super focused on details and delves down even more than I did. And so as a result, it's really helped with just that diagnostic component. And so that's been the most fun when we do our exams and stuff. In consults, we always do everything together on any new patient, and it has to make sense. Like he won't stop. We won't leave the consult until we have a working diagnosis, have the entire exam built, and then the exam has to satisfy it. If we can't explain something, we just keep going back and testing until we figure it out.
I love it.
It's really fun.
I love it. Yeah, details matter. I mean, so what is let's say that, I don't want to be morbid, but let's say that you knew you were going to pass away tomorrow, and then we're doing this video right now. What type of wisdom would you have to share with people struggling in chronic pain, as far as like what do people who are hurting do? How do they think about this?
No, a great thing. One is we had a priest. He was 94, 90, yeah, it was like 92, 94 recently, but he just passed when he was 96. Found out he was riddled with bone cancer, right? And he'd always say every day's a gift. So that's the first thing, is understand that it's and that's a lot of times what we do is we show people perspective, right? When guys can't squat 400 pounds, a lot of times they get upset, but they don't realize like it could be so bad that you can't even get out of bed. Like, so just perspective. So I get when you feel lost and really overwhelmed. So number one is don't quit. That's the first thing. Keep searching, because it has to make sense. That's rule number one. Dr. Brady used that as a diagnostic rule. Like, it always makes sense. So there is an answer. Don't quit. That's number one. But number two is that start with what you can change. So if it's nutritionally, like start cutting things out. You've heard stories of people go, I went to all red meat and water. Like, and don't just everything, but literally start taking notes and doing things. Try to avoid the emotional overwhelm that you get when it comes to that kind of stuff. That's just terrible. And then, so after you've done, and then keep searching, right? Obviously, so don't quit. Do the changes you can do. And then the other thing is, from a provider standpoint on the musculoskeletal side with adhesion, it's just super important that if I were to be dead tomorrow, the thing I want providers to focus on is you really have to focus on your palpation skills. You really have to know your anatomy. And that's the two things. Like, that's, if you have those two things, you know your anatomy super well, and you can palpate just like a champion, that's going to be the best thing for people to be better from that standpoint of stuff. Because then you'll start having another tangible finding that's not just a test that has a limitation from a motion or a function or whatever else, right? So that's the way you'll have to do it.
I love it. Be grateful. Don't stop looking for solutions. And then for the providers, make sure that for the non-surgical pain providers, make sure that you're feeling stuff, feeling tissue, and feeling well, right, and that you don't stop getting better at it.
Right. And, and overarching all of this is that there's an inherent, this is going to sound weird, but there's an inherent gift in suffering. Like, it's in the church, it's sanctifying, right? If we're going to think about it from a big picture standpoint, and this is where I sit with, is that but Jesus suffered the most than anybody else, right, on the cross. So if you have that suffering, you're essentially getting to be connected with Jesus and feel what he went through. So when I say everything's a gift, there's a reason why you're going through that stuff, which is the reason why you don't quit, right? That's the overarching thing. And wherever people sit spiritually and on their stance of God, but that's big picture is that you have to understand there's always a purpose to that, even if you don't. And there's so many things in your life, if you look back, you're like, oh, that's why that happened. And you can understand it, and there is a reason why you went through it and how you grew from it and everything else. And so that's all, as the saying goes, I hear all the time when we're in churches, God uses everything.
Mm-hmm. I love it.
So yeah.
Yeah, we're always connected. We're never alone. I love that.
Yeah, but it's really easy, and it's easy to feel like you are, right? That's what from a evil power or demon or devil, whatever you want to call him, right? But that's his thing, is to, one, make you think he doesn't exist, and two, to make you think that this is all you and there isn't any hope. That's his job.
Yeah, like separation type thing.
Yeah, correct.
And not one. I love it. Awesome. Yeah. And then for the people struggling in chronic pain, we have www.findanadhesionprovider.com, where some of your doctors and providers are there, and then the Adhesion Release Methods providers are under there if
Start
you're struggling. So yeah, we're growing that and getting more providers doing it, which I appreciate. Where do you see the work that we're going as far as the diagnosis and treatment of adhesion going in the next 20 to 30 years? Where do you hope it be by the time you're retiring?
No, that's a great question. What I hope is that, and I don't know, I hope there's, if there was a couple clinics, I mean, this is even small, right? In 30 years, who knows where it can go. But like, if you had a couple clinics in every state, so that way people could go, yeah, I can do a short drive or a long drive or a short flight to get there. Like, you have nothing to worry about. And really, when I say that, I don't mean like, oh, I do it. Like, no. You have, like, I'm super biased, but like people that are committed like you are, like the guys that we train that are all in, like Casey and James, as excited as they were today, right? That's a person who's hungry to solve your problem. Yeah. They're hungry for your health. Sometimes hungrier than the patient is for their own health. Yeah. Right? But you have to have people like that. Yeah. So many times people, sadly enough, they get into things because I can make money at this, or I can, it sounds like something okay to do or whatever else. But like if you want a job when those are the focuses, then don't be focused on someone's health. Go do something else. Right. This is someone you're here to serve them. So go do that. So you want someone who has I have a friend of mine, he calls it servant leadership, how he leads his company. So just a servant's heart. That's really important. Yeah.
Yep, for the providers to be focusing on, I'm here to help and make a difference.
Correct, right. You're there to serve.
Yeah. And you mentioned the United States too. We have had Dr. Chris, who I think he's from the old integrative diagnosis days, coming from Australia.
Oh, yeah.
He's come for a few trainings. Then last week at the Accelerator, we had Anna come from the United Kingdom.
That's awesome.
And she was here. She was shadowing for like 1 or 2 weeks, and she was just in the room every single day.
Yeah, we got Rodrigo coming in a couple weeks from Spain.
Yes.
Yeah, it's going to be fun.
That's what we need is more of those providers getting all those other places, because we have people DMing us all over on Instagram saying, I'm in this country or Antarctica or Russia or whatever, and where do I find help for this? So I like the vision of having more providers and more clinics where people don't have to travel so far for this. I love it. Any parting words? You already gave your wisdom, but anything else you feel like you need to say while we have this platform in this space here? And wisdom for people in pain or providers?
It's hard. I mean, having the injuries and stuff is hard. Celebrate the little successes. So when you have a day where it's less crappy, or you have a day where you can do something that you couldn't do the day before, don't be in a hurry to go do everything else. Just be like, okay, celebrate the success and do a little bit more each time for patients. And then for providers, if you're looking for something that's challenging but has a ton of purpose, this is the work for you. If you don't like that much work, because you're going to get kicks in the face all the time. Like one of the things I've noticed is that the guys who taught this type of work, Leahy and Dr. Brady, both went from treating patients to I'm going to teach, which is a very noble thing. Like go teach, it's great. Both of them started to get an altered perspective on what real life was like on their skill set and how it could help. I think it's because patients punch you in the face. They're like, I'm not any better. Like today we had one that came in that said, I'm 20% worse than I've ever been. What? You were 80% better yesterday for a little bit. Like how did I go from 80? What? That's like 80 from negative 20. That's like a full swing. Yeah. And what it is that, and accurate or not, that's her perspective. Right. So you have to be able to parse that out. Right. Well, students are always like, yeah, you're amazing. Great. I need somebody who's going to tell me I suck, not somebody who's going to tell me I'm amazing. Right. Yeah.
Facing reality, doing the hard work, making the hard decision. Those are all things that...
You got to love a little bit of the suck. You got to be able to be comfortable in the suck. Maybe not love it, but you got to be comfortable with like, yep, just going to hang out here. And you have to be great with self-improvement. That's why I think Ryan was so much fun, because he was a D1 college wrestler.
Ryan Pribble.
Yeah, Pribble, yeah. A D1 college wrestler. Like he was comfortable with getting beat on, right? It's like he's uncomfortable with making himself uncomfortable. Yes. And so when he's like, I can't solve this, I'm going to go make myself uncomfortable. Like it's an important skill set to have. Right. And I think in a world that focuses a lot on comfort, like, oh, don't be uncomfortable. Right. We got to make sure this is okay. Right. That people that have real discomfort get frustrated. Right. Like we're like, well, I was made uncomfortable with that. Like that's your biggest concern? That seems because your toast wasn't toasted the right way or whatever else. That seems like a low bar. Let's raise it a little bit.
Yeah, I love it. This Polish guy, Jerzy Gregorek, says easy choices, hard life, hard choices, easy life. Yeah. And I love that. That's
right. Or the circle one that says, what is it?
Yes.
Weak men make hard times, hard times make strong men make weak times.
It's true.
Yeah.
It's true.
I mean, because it's just, I was, my son, he was working on a cattle farm. Not that there's not people that do that all the time, but I mean, he's 17. He's in a normal kind of suburban setting. But he went out and he was doing some landscaping work with these people, and then he met this guy who had a cattle farm, and he was helping with his trailer because he was stuck on the side of the road, and the guy offered him a job. And so here's my son. He's gone out there, and he got up in the morning, was there by 6 a.m. He's riding and, doing all this cattle work and this kind of thing. And I'm going, how many 17-year-olds on a Saturday morning are going to go do that stuff? And he made a comment. He goes, yeah, people are afraid to do these things. And I said, why do you think you're not afraid to do that? He goes, I don't know. I was like, did you ever get dropped in the deep end? He goes, yeah, you did it all the time. Like, you just make me do it. You don't even ask if it's okay. You just go. I was like, yeah. And he goes, I don't let you. He goes, no, you don't let me drown, but you let me struggle a lot. I was like, huh? That's the reason why. Brilliant. I was like, it's okay.
At what age did you think you start pushing him?
I'll give you an example. We would be at home, and by the time they're like 6, 7, 8, they want to help dad out and whatever else we're doing. Fine.
You're a little teary-eyed.
Maybe 5, yeah. And we would go out and we do work. Well, when we do work, like we start and we take a break when we're done. That's how I've always operated. Well, they would get up, my wife would make them breakfast. They get out there and they work. And then she's like, oh, well, and by the time they get out there, it's 10 o'clock, right? And this is when we first started doing this kind of stuff. And then by noon, they're like, and I was starting at 7 and they're 3 hours late. And then by noon, she's like, we should get them lunch. I was like, they just had breakfast. And so they're like, well, I was like, no. And so I just put the kibosh on that. I was like, look, we're doing work. We're going to do this project. If you're going to help me, we're going out, we're going to do it. And so they're like, oh. But then they had more time. We worked together. We were successful together with it and everything else. And so when we used to do all these events to help the endurance athlete community way back in from 2010 on. I remember my 7-year-old, he was going around and he would look at somebody who was stretching. He goes, my dad can help you a whole lot better than those stretchers can. You want to fill out the paper? And he would just go through that. They're running cord. They're doing all kinds of stuff for all the things we need. It was funny, but yeah, no, I've tried. Working is a good thing. There's grace and toil.
I have a 6 and 3-year-old, so I want to set them up for success. So that's why I ask. I appreciate you sharing your perspective.
No, it's fun, and it's not. There's a difference between browbeating someone, like making them do just overworking them, versus let's go get this project done. And when it gets hard, but now, my son, heck, he solves more problems than I ever will. He's so good at so many things, and it's so beautiful to watch. They're going to run past me like lightning speed. It's awesome.
I want to thank you for having this conversation with me. This conversation is important to me. I believe I talked to you, to all the Adhesion Release Methods providers. I talked about you to our patients. I talked to you about our staff. And I think it's important that people suffering chronic pain know who is trying to lead, I might say, a revolution or a transformation of healthcare. So it's very important to me that people know who you are. If you're struggling in chronic pain in the world, wherever you are, there's no one that I think is better at fixing your chronic musculoskeletal issues than Dr. Matt Lytle, who's sitting in front of me at Precision Health Group in St. Louis, Missouri. And you could find him on Instagram at Precision Health Group, and you can DM him. I think Dr. Brandon is still in the DMs. So if you want to tell him that adhesions don't exist or you can't treat adhesions and you want some funny answers, just DM Dr. Brandon in the inbox at Precision Health Group, and he'll get some funny answers. Yeah, thank you so much. Absolutely. It means a lot to me that we did this, and I'm excited to see where all this goes. And thank you for teaching me.
Yeah, thanks for the conversation.
You're welcome.
And making me uncomfortable.
I love making you uncomfortable.
That's awesome.
Ditto.